High-risk myeloma has been historically defined by patients who do not do well with early treatments, have early relapses, or even die from the disease. But that definition has always been quite heterogeneous, sometimes related to disease burden, other times, some clinical features such as circulating tumor cells or extramedullary disease. And then you've got a host of biologic features that we can detect by doing cytogenetics or FISH analyses. So we are now moving into an age where we have genomic tools and can understand that disease biology better. However, there hasn't been a dedicated meeting just focused on high-risk disease. And we know that as therapeutics in myeloma get better, that definition will change. We'll be able to overcome that high-risk prognostic or poor prognostic implication from that biologic marker with some of the therapies that we currently have in our pipeline. So we're trying to develop those recipes. So this workshop is kind of a nidus for that. It's a platform where all of us come and talk about these nuances, both on the basic science side, translational science side, and also figure out what would be the best way of doing the clinical trials that will make impact for these patients. And so this year, it's been an outstanding meeting. There has been a lot of genomic and microenvironment focus. We are learning more and more about this. I think in the second day session, the discussions have been more around how do we rationally design clinical trials for high-risk patients. Is it all high-risk patients? Should we be focused on certain subsets that we consider high risk right now? And also, what will be the future definition of high risk? So I think, this again generates a lot of enthusiasm amongst the participants, and many good ideas have already come out. So we're really looking forward to working on those ideas and coming back next year and sharing with the rest of the group.